Welcome to this week's podcast by Step Kidz Nutrition, where we explore matters related to pediatric nutrition with an invited guest. My name is Professor Roseanne Meyer. I'm a specialist pediatric dietitian with almost 30 years of experience in pediatric nutrition. In each podcast episode, we will dive into the science and also practical tips behind topics related to childhood nutrition with an invited specialist. Whether you're a healthcare professional, a parent, or just interested in pediatric nutrition, you're at the right place. I'm absolutely delighted to have Professor Carina Venter on this podcast. I am going to read off her biography because Carina is a very good friend of mine, and I'm concerned that I might leave something out outside of saying that she's a dietitian and she's a really good friend. So Carina, here I'm going to go and say that you are Professor of Pediatrics, a section of Allergy and Immunology at Children's Hospital Colorado and University of Colorado in Denver. And you are doing a lot of research in allergy prevention at the moment. I want to also say you've done a lot of research before that on prevalence of food allergy, those type of things as well. And then also you're one of the founding members of the International Network for Dietitians and Nutritionists in Allergy, so in DANA as well, and you were chair. You've received accolades from many international allergy societies. I'm not going to list them all, but I think what is important is that you're extremely well known. You are a registered dietitian, South Africa, UK, I think, and also in the US. So you're similar to me. We are kind of, haven't got the US, I've got Switzerland. And then you've published so many papers and guidelines on food allergy gene diagnosis. Most importantly, Carina, you're a member of the Step Kidz Nutrition dietetic team. So welcome and thank you for joining us today.
Well, thank you, and thank you for the invitation to be here today.
Perfect. So the topic today is on allergy prevention, and I'm going to launch right into it and just going to say, can you prevent allergy?
Yes, I think the short answer is yes. I think we know a little bit more about prevention of food allergy in infants. And as we know that the LEAP study, which was the early introduction of peanut study conducted from London in the United Kingdom, showed that we can reduce the risk of peanut allergy by 80%. I think we have less data about prevention of other allergic diseases such as asthma, eczema, allergic rhinitis, hay fever, or seasonal allergies, as people refer to it here in the States, than food allergies. But it's particularly the maternal diet in pregnancy that seems to be a hopeful avenue for prevention of food allergy as well as these other allergic diseases.
Yeah. So actually then we kind of focus on food allergy specifically. We are both dietitians. So I suppose my next important question is, and I think you touched on it, what is the most important time for prevention of food allergy specifically?
Yeah. So when it comes to food allergy, I think the data shows that we need to intervene in the first year of life, and that we really need to stop being concerned or stop being scared of feeding children food allergies. I have often been quoted to say, just let the babies eat, Babies eat when they're ready to eat. There's this big debate about, what is the exact perfect time to start introducing solids, for the prevention of food allergies. And the short answer is let the baby tell you, because babies can be ready to eat at 4 months. Roseanne, I do a lot of work with you in infants, and we both know some babies are happily breastfed by 6 months of age. They take no notice of the food around them. They're really not sitting up properly, even with a bit of support, and nobody's going to force feed that baby from 4 months of age. But then we have these 4-month babies in clinic. They were almost born ready to eat. They're 4 months old. They're looking around. Every little bit of noise, they're looking. They're interested in food on the table, and they are ready to eat. So I think this is the main message I want to give today: is listen to the baby, start feeding them solid foods when they're ready to eat. And don't wait with the allergens, Once you've done a little bit of apple puree, ideally homemade, or a little bit of mashed banana or some spinach, get the nut butters in. always dilute it with hot water, then cool down, because of course feeding a nut butter from a spoon, as we know, is a choking risk. But get the butters in, get the yogurt in, get the mashed up egg in as soon as they're ready to eat.
So, Karina, I mean, look, that is a passion of mine, to be more natural and to say that let's not medicalize something. And I love it what you said. So I want to take a step back. So you touched very quickly on pregnancy. So I'm going to split it up and saying, can you prevent food allergies specifically, even if we think if there are the parents listening to this and they are going, we want to have a baby, but mum is atopic, dad is atopic. So can you already start thinking about that during pregnancy? And then we'll move to the other stages.
Yes, so, as much as I love seeing, babies in clinic, a lot of my research, especially in the last 8 to 10 years, have focused on the maternal diet in pregnancy. And once again, the short answer is yes. But here the emphasis is not so much on eating the allergens. The emphasis really is on having a healthy, diverse diet in pregnancy. And so my data from the United States have shown that when women have a healthy, diverse diet in pregnancy, we can reduce all allergic diseases and some food allergy. My data was not statistically significant just because I didn't have a big enough sample size. But then I was blessed to have a postdoctorate student, a dietitian, Stina Boden from Switzerland, actually from Sweden, spending some time with me. And we look at the Swedish North Pop population. We calculated maternal diet diversity again, and we saw a significant reduction in food allergy in the children in up to about 4 years of age. So really, in pregnancy, we all have had morning sickness. We don't always feel like eating certain foods. We really don't want to be counting calories and weighing off food portions. So the message is simple. Eat as a diverse diet as possible. Every food counts. So if you're eating 5 fruits, it's better than 3. If you're eating 10 vegetables, it's better than 2. And also plant-based proteins really help to add to that diversity. Yes, answer is short. Stick to healthy foods and keep it as diverse as possible as your pregnancy will allow you to have.
Yeah. And I want to just, because I have heard you lecture on this topic, I want to just be clear. Does diverse mean you have 5 different carbohydrates, or does it mean diverse also fruit and vegetables? If you can just clarify for our listener, what does diversity mean?
That's very good. Good question, because diversity literally mean you count every healthy food you eat. So that could be 1 grain, 1 vegetable, 1 fruit, 1 plant-based meat, but then it can also be 5 vegetables, 3 fruits, and 2 plant-based meats. So every healthy food you eat gets you a score of 1 at least. Now people ask me what's the ultimate score. I don't think there is an ultimate score, but clearly, especially in infancy as well, we've shown that every additional healthy food brings the risk down. And the same really applies to pregnancy. So the more food you can eat, the better. For some women, it may be that they can literally only get 10 foods in because they're really struggling with nausea. Other women can eat 100 different foods throughout the course of pregnancy, not every day or every week, literally throughout the course of pregnancy. So do the best you can.
Yeah, and I think that's really an important message, and we'll have an international crowd listening to say what the foods are locally available in your country.
Absolutely. The dietary guidelines of the Americans have just come out yesterday, and they really put emphasis on just home-cooked healthy food. And, when we actually looked at the data from Sweden versus the data in America, people said to me, you won't get the same results because women in Sweden eat so different from women in America. But it actually didn't matter as long as we counted the fruits and the vegetables and the grains and the plant-based protein women eat in America, and we counted the different fruit and vegetables and plant-based proteins and grains they eat in Sweden, we still got the same result. So eat what's locally available in your country. But unfortunately, and I have to say this too, we had this wonderful opportunity in America to also count the number of unhealthy foods the women ate. Because, you can just drive down my street in America and I can go to 5 different pizza places and 10 different hamburger places. And when we counted all the unhealthy foods, we saw a significant increase in allergic diseases. Is what's strikingly significant. So as much as we want to count the healthy foods, we also don't really want to count too many unhealthy foods, because that definitely increases the risk. And so in the Sweden women, we didn't have the opportunity to count unhealthy foods because they have a predominant healthy diet.
And I think we'll do another podcast on really the ultra processed foods. I think that really warrants a much more depth discussion.
Absolutely.
Carina, if we move from pregnancy, where the answer is yes, to that really tricky period, before complementary foods, which you've already touched on. So a common question we get in our practice, new babies born, what can you do? The baby's born before complementary feeding, or is there something that can be done then?
That of course is a very, very sensitive issue, is what do we do between birth and when the baby start eating? And so the first thing that I want to say is absolutely, if mom can breastfeed, she wishes to breastfeed, and baby is happy to be breastfed, we're always going to support that. Unfortunately, there's very limited evidence to suggest that breastfeeding prevents allergies. In terms of food allergy, there's just no data that breastfeeding prevents food allergy. There's some data that breastfeeding can prevent asthma, and that breastfeeding may prevent, atopic dermatitis in early life. No data really on allergic rhinitis or hay fever. But despite that, we're always going to support breastfeeding. I think that the complexity comes in when, for whatever the reason may be, the baby's not being breastfed or not being fed human milk, which is probably the more politically correct term. And then what alternative do we offer? The guidelines across the world, you and I have been involved in many of those, say that there's no evidence to suggest any hypoallergenic formula that could be partially extensively hydrolyzed formulas or even amino acid-based formulas for the prevention of allergy. But, do we then give them cow's milk-based formula? I think, again, it's a very, very sensitive issue. I'm not sure it will ever be incorporated in guidelines. But what we do know is that when babies, if they fed cow's milk at some point in early life, we need to continue. The immune system doesn't like us to chop and change our minds. We know that so clear from all the studies we've done in infancy. So once you've given an allergenic protein like cow's milk, you need to continue. This is now where the practical issue comes. The data that we got from Asia show that if we give just perhaps a teaspoon or, perhaps a tablespoon, 30 milliliters or 5 milliliters of cow's milk alongside breastfeeding, if cow's milk was introduced early in life, then mothers actually continue to breastfeed. We don't actually reduce the timing of breastfeeding, but we're still showing the immune system that this allergen is being present. Whether, that will ever become standard clinical practice, I don't know. But I do want to say that I personally feel strongly that the evidence show us, and we have other beautiful data from Israel showing the same thing. Once the child's been given a cow's milk protein, keep a little bit in the diet alongside successful breastfeeding. But once you've started, don't completely stop. I don't know if you want to add to that, because you've done so much work in this field.
No, I'm so glad you brought up this controversial issue, because I know when you bring it up that it somehow feels wrong. And certainly, and I want to really support you, we are absolutely supporting breastfeeding. What we're just saying is that a lot of times it's for blood sugar levels that are dropping, that occurs. And then all that needs to occur is exactly, that doesn't need to be with a bottle, exactly with a teaspoon or with a cup, small amounts to continue. And so I feel very comfortable with that message. And I think the research that has been done has shown us that you don't just chop and change in that early period of time.
Definitely. But the problem is, like you say, when the blood pressure drop, nobody's just going to stand and look at a baby or the blood sugar, drop. Nobody's going to look at a baby and say, we're not going to feed the baby because we don't want milk allergy. So there's definitely instances where we have to give that formula. But then I would say, like we've said, small amounts probably won't do any harm to breastfeeding duration.
So, Carina, we've now spoken really about that tricky stage between birth and the weaning age. You've already highlighted with complementary feeding, in particular, the LEAP study. I want to ask also about the other allergens. We've got so many tree nuts. What about egg? What about wheat? What about milk? Where do you sit on that?
So, yes, the LEAP study nicely showed us that, peanuts need to be introduced, or peanut butter in a baby safe form needs to be introduced as soon as we start feeding babies. Then following from that, we had the EAT study, another wonderfully, beautifully conducted study from England, showing that when we introduce peanut and egg in early life, we can reduce peanut and egg allergy. Following on from that, we had some other studies across Europe and Asia in particular, really giving us some hints at least that we don't need to delay the introduction of other food allergens. And I think all the guidelines in the world now agree that, peanut needs to go in, egg needs to go in. The American guidelines clearly highlight egg as well as the European guidelines, but then go on to say, then don't delay the introduction of the other allergens. My clinical view on this again is you need to look at the allergens in your particular country. I think for most of the European, UK, American intervention, practices, we probably go for peanut, egg, cashew, and walnut as the first four allergens. It doesn't necessarily have to be in that order. It's a family that loves cashew butter or cashew nuts. That may be my first allergen, but I would definitely get those first four in. And then I think the other tree nuts, the introduction of seeds, and then also fish and shellfish is really country and family dependent. I think to force a family to eat fish just for allergy prevention, if it's a family where they just never eat fish, I think is probably not a good idea. We also struggle, as you know, with what to do with Brazil nuts and macadamia nuts. That may work for some families, may not be important for other families. When I see patients in the UK, I feel introduction of hazelnut is more important than in America, just because
Certainly in Europe.
Yeah.
Certainly in Europe.
And definitely in Europe, I don't consult in Europe, but I agree for Europe, because we know that if chocolate in Europe has a may contain statement for nuts on, it's most likely hazelnut, and it most likely is contaminated. So I always say to the UK families, if you guys are going to eat European chocolates, let's just get some hazelnut into that baby.
Yeah, no, I absolutely agree. So I want to also come here with a difficult question, because for me, I often see children with feeding difficulties. And I have a bit of a bee in my bonnet with having a child being handed out this sheet of, 9 nuts, then a fish, egg, all of those, which puts under huge pressure. You've already given a tip on, think what is common in that country. Where do you sit around introduce everything and make sure that they have everything? Baby so young.
So first, I really want to take this opportunity to say, if you need help or hand-holding with introduction of allergens, do contact us at Step Kidz Nutrition, and we will definitely make a plan to help you. We will also put a link to my Nourish profile in the United States if you wanted to come and see me. I definitely don't like handing out sheets to anybody for any kind of food allergy or introduction of allergens. I do think it puts a lot of pressure on the families. Just this morning, I said to a mom, but do you know that if you do walnut, you could probably just ignore pecan? And if we introduce cashew, we could probably just ignore pistachio. She literally burst out in tears and said, I had no idea. I'm so relieved, because all these nuts are just so hard to do. So I think, there's a number of things we need to think about. It is a lot of protein and calories, but it's good fat, so we want that. We really want to think careful about which nuts and seeds we're going to introduce, not to burden the families too much. And then again, if you contact us, Roseanne have this wonderful mixed nut recipe, which we give to families just to reduce the burden, because I do think that it makes sense to do each single nut, introduction of each single nut separately. But once you've done them all, it makes perfect sense to make a nut butter, put it in the fridge, and just give 1 or 2 teaspoons a morning. And again, if you contact us, we will tell you how to introduce these nuts throughout the day. It doesn't always have to be in the morning. And Roseanne, how long does the nut butter last in the fridge?
So it's a great question. So I've tried that. Look, I have it daily in my diet. So I've kept it in the fridge for a good 2 to 3 weeks
Yeah.
without any difficulties. But I want to be honest that I often, for me personally, not for a child, skim off the oil on top. Okay, so you should not be doing that for a child. And if you had an oil layer on top, that would last, I think, much longer. I've actually been experimenting, which I'll post on an ice cream made with 150 gram of mixed nut butter with just a banana and a little bit of plant-based milk. And I've calculated, because there's no sugar or anything in there, that, I mean, that would be your solution, therefore, for a very, very long time. And I think even during the winter, that might work. So yeah, we're constantly, I think it's a good message, we're constantly working on new recipes to get that out. Can I just get another question in there, which is a
Yeah.
common question that I get, which I see a lot of tears on. So
Yeah.
you get this, they need to have 2 grams. So let's say, 2 teaspoons of a nut butter. So your child is pooling it and spitting it out and not wanting it. Is this magic around 2 grams? Have you broken something if they're not having exactly that amount of nut butter?
Yeah, so I have to say, I have two views on this. We will put another link for you to have a look at. It's called Let's Grow Happy. It's a product that I helped to develop. It contains 5 allergen butters. It's egg and sesame, and then 3 nut butters, which is the peanut, cashew, and walnut. In this range, we have 2 grams of allergenic protein for each of the allergens. Because looking at the Eat and the Leap data, it seemed to be that 2 grams of allergenic protein 2 to 3 times a week is really the best way to prevent allergies. And that's why, from a technical point, that is the magic number. From a practical point, I really think, I don't want to use the word believe because that's a very unscientific term, but what the immune system has shown us is that it doesn't like us stopping or discontinuing an allergen. And as much as the studies give us this 2-gram answer, there's no study in the world that's shown that if one day it was only 1.5 gram and the next day perhaps only 0.5 gram, that the children developed allergies. The only study showing risk is when you stop after you introduce. So my practical view is, and I want to get back to babies know best. Some days that baby is going to take a tip of a teaspoon and it's going to spit it out, and that's it for today. No more nut butters. Other days, baby is going to be really hungry, might have had a very active day crawling around. That baby is going to ask for an extra teaspoon. Please give it. So really, I think we need some guideline. I think 2 grams of allergenic protein is make us feel safe because we know what we're aiming for. But just know that the baby will tell you whether he's going to be on the lower end of the dose or perhaps on the higher end of the dose today. So just relax, enjoy your baby, enjoy feeding your baby. Give the baby a chance to learn to love food rather than us, being so fixated on a particular dose. And we say the same with Let's Grow Happy. We say we have these sachets or packets, but let your baby guide you on whether they're going to eat the whole packet or not. And if they want a second packet, then of course we're very happy with that too. I do
Yes,
want
and
to
sorry, you first. No, you first.
I do want to say something else. I'm just publishing data. I'm so excited. Getting back to the nut butters, I really love the butters so much more than the nut flours. Our data shows that the children with eczema, their skins absolutely love fat, and they literally mop it up like a sponge, even when we compare them against children without eczema. So, feeding the nuts and the nut butters is probably a wider thing to address than just preventing the allergens, because it does help to keep that skin healthy as well.
And there's some data from our friend Liam O'Mahony also around the microbiome, which I think warrants another discussion and possibly one between us three. But I think we all support nuts, butters wherever possible. And I want to also acknowledge as a dietitian that I do know that some of them are extremely expensive. But I think that's where the strength of a dietitian comes in, is to make those calls, exactly what you're saying, to say, look, Brazil not very common, not in the UK, and if you buy them, very expensive, but let's focus on those common ones. And again, seeing a dietitian there helps because we have so many recipes and recipe ideas. Carina, so I want to move on to also some other questions as we're kind of coming to the end of this podcast. And that's really around probiotics, prebiotics, symbiotics for allergy prevention, food allergy prevention. Should you be routinely giving them?
There is no data to suggest that using pro, or symbiotics prevents food allergy. The only guideline in the world is the World Allergy Organization suggests that using probiotics during pregnancy, breastfeeding, and early life, and it was a particular probiotic, may prevent atopic dermatitis or eczema. But other than that, unfortunately, we have no data to say a particular probiotic will prevent food allergy. Having said that, Roseanne, and you quote those studies a lot as well, it's disappointing that we don't have the data, because when we look at the gut microbiome of children with food allergy versus children without food allergy, and it doesn't matter which type of food allergy we look at, across all the different kinds of food allergy, consistently children with food allergy have lower bifidobacteria levels and they have lower lactobacillus levels. And we don't want low bifidobacteria and lactobacillus levels because they make this magic chemical in the gut called butyrate, which helps to calm down immune cells. So it makes so much sense that we would feed babies bifidobacteria and lactobacillus. I don't want to get into the particular strains, and that we will reduce the risk of food allergy. However, when we do the studies, we don't see the outcomes we want. And so I think we need more data to really understand why this is happening.
And I can just imagine lots of parents listening to this and saying, oh my God, Roseanne, you recommended a probiotic. And I still do in a lot of my clinical practice, but I always say that's on an individual basis. So what you're talking about is, large populations might still recommend. But I am always very honest to say, look, I'm not selling this as a panacea to all problems, but as long as it does not do any harm, from what we know, exactly it's the butyrate that the anti-inflammatory impact.
Okay.
But do you also sometimes recommend it, even if you say, well, on a population basis?
Yeah, because I think a lot of the parents listening to me now say, she's just made me buy that probiotic.
Exactly.
I definitely use a probiotic in children with existing food allergies, because without testing their gut microbiome, I know they're highly likely to be lacking in bifidobacteria and lactobacillus. And I know, Roseanne, you and I use very similar probiotics. We always look for the one that contains both. And so, yes, I must say, I'm trying to think now whether I've ever suggested a probiotic in a healthy baby with no allergies, just for the odd chance of preventing allergies. And I'd say no, because the majority of the kids that I see, and I'm sure you, have got eczema and or food allergies. And those are the groups where we use the probiotics because of the reasons I've already stated.
I've certainly not in healthy children, it's more the dietary diversity that I promote. And of course, breastfeeding really contributes from that perspective.
But I do want to say you and I then do exactly the same. I know. We say use the probiotic, but that diverse diet is probably more or just as important to actually get that gut microbiome healthy. And two of the papers I've recently published, and I am obsessed with them because I love blueberries. But I've just done a randomized trial in infants where we showed that if you feed babies blueberries in the first year of life, you actually beneficially change their gut microbiome. So they make more butyrate and you also calm down the immune cells. So, diverse diet, get your fruit and vegetables in.
I think that's a beautiful message. So, Carina, I'm going to ask you just if you have 5 top tips. I know you've got 10, but, really, what would be your top tips? I think we've heard a couple of them, but for somebody listening, and what are your take-home messages?
Okay. The first thing is, I think, listen to your baby for when they're ready to eat and how much they want to eat. The second one is, it's hard to relax about feeding, especially if your child have eczema and food allergy, but really try to enjoy the journey. The third one is focus on a healthy gut microbiome. A diverse diet is key, but every food counts. I know that Roseanne sees a lot of children with feeding dysfunction, and I see mums with feeding dysfunction. They come in and say, oh, you publish about diverse diets, I don't want to see you. I say, relax. 2 foods are better than 1, 5 foods are better than 4. Then I want to say, I'm trying to think now of number 3.
Don't delay allergens.
5. Don't delay the allergens. Don't be scared of allergens. They are not the enemy. And then number 5, you've just helped me on that one, is if your child already have an allergy, it is food allergy. This is not a life sentence anymore. There are so many ways nowadays that we can induce tolerance. Roseanne and I do a lot of milk and egg ladder education. We can really help the majority of children to outgrow their milk allergy by the time they're 2 or 3. And for the other allergens, there's now so many options such as sublingual immunotherapy, oral immunotherapy, and even the patch. So do what you can to prevent the allergy, the food allergy. But if they do have an allergy, it's not the end of the world. We can definitely get rid of most allergies by the time children are 5.
I think that's an amazingly positive message to end this. And for our listeners, first of all, thank you, Carina, for sharing that knowledge. Then what we'll do is also wherever Carina mentions the link, we'll make sure that that's available as well, so that you've got that. And then, of course, you're very welcome. This will be posted on YouTube and also on Spotify to comment or to send a like or to get in a contact with us. That's under Step Kidz Nutrition. We'll make sure you've got that link for that as well. If we've got enough interest, we might even run a webinar. So we've both said we're quite open and we're very happy to do some education around it. So thank you again, Carina. And I hope to all of our listeners, this was really very educational.
Thank you for having me, and I hope you've enjoyed it as much as Roseanne and I enjoyed talking about prevention. Jackie emails hier, maar nie moet tel het nie. Ek gaan ook die donderdag kom en dan gaan ek die maandag gaan. Maar as ek kan dit altyd
hulle het gesê 4 nagte, so ek het
Ja, maar ek worry gewoonlik nie oor die dae voor en na nie, want daar's altyd plek in die hotel. Dis net daai jakkie daar.
Ja, presies dit. Okay, luister, ek sal nou
regtig my sound is nou nie te bad nie. Ek's jammer, ek wil nie jou tyd mors.
Moenie maar. Thank you for listening or watching this week's podcast. You can follow me on various social media platforms, which we'll share on the screen, or you can visit my website at rosannepediatricdietitian.com. You can also like this podcast on our Step Kidz Nutrition YouTube channel. Thank you very much.